Hi, my name is Anna Gilman, and I'm a member of INGEST, a research team at Trinity College Dublin, which is investigating swallowing difficulties in people with esophageal cancer. Many patients who have esophageal cancer have to have part or all of their esophagus removed in an attempt to remove the cancer, and as a result of this invasive procedure, many are left with difficulty swallowing after their surgery. Little research has previously investigated whether patients continue to experience swallowing difficulties in the long term and whether this impacts upon their quality of life. There's thankfully now a growing number of survivors due to improved treatment techniques and better patient selection, which means that there is now this bigger group of people who continue struggling with swallowing and need more help. Our research team decided to conduct research which would help us to understand whether patients are in fact experiencing long-term swallowing problems, and if so, what these difficulties look like, and how they impact upon their quality of life. We recruited 40 participants from St James's Hospital, the National Esophageal Cancer Centre in Ireland. We recruited 10 women and 30 men who were an average of 66 years of age and 4.5 years post-surgery. Each patient had a video fluoroscopy, which is a moving X-ray of the swallow. They participated in a clinical swallow assessment. They answered questions relating to how they perceive their swallowing difficulties, and they participated in an interview which explored how their quality of life was impacted. Our results showed that 35% of these patients living in the community were still experiencing swallowing difficulties to some extent, and that there was an association between people having swallowing difficulties and having to avoid certain foods or modify these consistencies. 80% of patients had difficulty clearing food from their esophagus, and this was actually associated with difficulties detected higher up in the throat, which may be an early indicator that a change in the esophagus changes how the swallow functions higher up. Quality of life was mostly mildly impacted by swallowing difficulties. However, when we asked patients to explore this in more detail through an interview to determine how all of their swallowing and digestive issues impacted upon their quality of life, some patients' quality of life was significantly impacted, causing them to feel isolated in managing their symptoms, fearful of choking, and these difficulties were hindering upon their social and work lives because of the discomfort, the pain, and the embarrassment around the symptoms. We also conducted a systematic review of the literature to see if there was any published evidence which might guide swallowing rehabilitation in these patients. Unfortunately, there was only a very low volume of low-quality study to guide clinicians. So ultimately, this means that there is a huge need for more research to be conducted, which will look at how to rehabilitate these people's swallows. There's also a need for more support in the community to manage their ongoing symptoms that appear to exist for many years and impact the quality of life for some.